welcome you all here in the 11th episode of the Weekend Homoeopathic series. And I warm welcome to ma'am for this session and very thankful ma'am for you coming this session. Uh, Hello,
Hello.
am I audible?
Yeah.
Okay, ma'am. So yes, we are going to start a session with ma'am introduction, a little introduction about ma'am. So here in front of you, Dr. Kanupriya Pareek ma'am from Rajasthan. She is currently doing her PhD in from Tantia University and working as a assistant professor in University College of Homeopathy, Ajmer, and founder of Pareek Clinic and Research Center. Am I right, ma'am?
Yeah. Thank you so much.
Yes, ma'am. So yes. Yes, ma'am. So, ma'am, we'll start this session with the topic of organ of medicine, as the research topic is very difficult to understand, difficult to do, as we PGs and everyone always in confusion how to select the topic, where to select topic, what is the sources and everything. So, hope we are going to clear this today by you, ma'am.
Okay. Thank you so much for inviting me as a guest for this program. Actually, the thing while going to start the session, why I'm choosing this
Yes, ma'am.
topic, as you all know that Organon of Medicine is the neglected subject by the students in the BHMS,
Yes, ma'am. Very
right?
true, ma'am.
This is the factual thing, right? And
Yes, ma'am.
when
Exactly.
yes, and when they are giving entrance exam for the MD, so there are preference to take the medicine subject, and the second option is the material subject, and the least
Very true, ma'am.
preference they are giving to the organelle subject, right? So by chance, the few only 1 or 2% students are interested in the organelle subject, right? And rest of the students will get the organelle subject not by their choices, but by the compulsion, or they are not getting involved in the different subjects, right? So this is the
Yes, ma'am.
main
Yes,
thing,
ma'am.
that the students are not focused on the organ subject, right? So it's a big challenge for the homeopathy fraternity and for the students also, that how they are going to select the organ and research topic, right? Before going to start this topic, we must know that how do we select the research topic first, right? Because if we
Yes, ma'am.
know that how do we select a research topic, not only for the organ and subject, but in journal, right? Then we must know that what are the challenges and what are the difficulties and how we select a topic for the organ, right? So as you all know that what is research and why we are doing research in the MD and in the PhD, right? And nowadays it is a very important and a very booming thing, right, to raise the homeopathy, right? So
Yes, ma'am.
those who are attending the session, I request you all that you must do research in the field of the homeopathy, so we can prove to the world and we can prove to the modern medicine that homeopathy is still doing the very good results. And as you all know that it is the second world largest pathy in the world, right? So we need to
Yes, ma'am.
prove the homeopath, right? So we need to prove ourselves also, right? So without wasting so much time, so now the topic is how to select the research topic. First, what is your interest in the research, right? Choose a topic in which you are interested, because whenever you are interested in a research topic, now, then and then only you will find out the difficulties in that area. You will find out some good things in that area. You will find the new techniques in the areas, and you will have a complete knowledge and a full knowledge about that topic. Right. So whenever you are choosing a topic, now discuss with your mentors, discuss with your guides, and discuss with your friends also. Why I'm saying that? Because if you are discussing with the people now, then they are giving you some different ideas. And then you will know that whether I'm choosing the right topic or the wrong topic. And what are the things that what we are going to do in this topic? What are the new things? What are the new techniques we are going to apply in this? Right. So most of the people are not sharing their research topics with the friends also. They're hiding their topics. This is the common thing.
Yes, ma'am.
But if
Exactly.
you are but if you are discussing that, then definitely you will get so many beneficial things, right? Because
Yes, ma'am.
see, you are using only your mind, but when you take advice from the seniors or your friends now, then they will give some inputs also. So you will have developed some another ideas also, right? Then after discussing, search the topic through online mode, right? we have so many online sites, we have so many online data available regarding the topic, right? So must find out the topics on the online. Then you have a full idea regarding the topic, that what you are going to do, what are the new techniques in the field, what are the old techniques followed by the old school or the other physicians or the other people, and what are the previous researches done on this topic. So whenever you find all the data now, then definitely you will have a fixed idea in your mind that I am going to do research on this topic only, on this criteria, then I'm selecting only these criteria, because whatever the previous things are doing and whatever the new things you will get, then you will collaborate both the things and compare that what is important, right? And us field ke andar what are the new things added, so definitely you will get an idea of the new things also, right? Then whenever you choose the topic now, then narrow down your research topic. Why I am saying this? Because if you are choosing a broad topic, then you have a lot of material, and you have broad, it's a very broad topic, so you will got a broad material and large number of material on this topic, and you will get confused कि मुझे इसमें करना क्या है. So always try to narrow down. Like for example, if you are taking the respiratory disease, so see there are a lot of respiratory disease, so select at least one respiratory disease or one condition, right? And in one condition, what are the parameters you are using? Select only those things. Because whenever you search the respiratory disease now, so there are a lot of research papers on the respiratory disease, on the other systems, right? So we have to narrow down all these things. Because if it is too broad now, then you cannot focus on the areas that you have selected and what you are going to focus on, right? And the background reading can help you to choose the limits and the scope of the topic. Because obviously when you read about all the data that previously published or the previously available, so definitely it will tell you about what are the scopes in the future, what are the scopes and what are the limitations of this topic. So definitely you will know that what are the beneficial of these topics. Then while doing the research on this now and while finding out the things on the online, then you are using the keywords. What is these keywords? Like you are doing research on the respiratory system, right? And you are doing research on the individualized homeopathic approach. I'm just giving an example, right? And if you are doing a research on some specific thing, like I'm only choosing the homeopathic remedy. So you have three things, like you have the homeopathic medicine, right? Keyword, you can take the homeopathy. Just a minute. Sorry, I'm on call. Could you please consult me after half an hour? Okay. Sorry, actually patient is there.
No, it's okay, ma'am. So very time, so I understand.
Okay. Sorry for the interruption. So, see, the first word is the homeopathy, because you are taking the homeopathic remedies, right? And the second thing that you are doing the individual approaches, right? So the second keyword is the individual approach. And the third one is the respiratory disorder. But you are not specifying what respiratory disorder, right? So, okay, it's okay if you are taking the respiratory disorder. So there are a lot of bulk material on the research, on the respiratory disorders. Then you have to choose which topic you are to specify, like the pulmonary infection, like the lung infections, or whatever the disease, right? So now you will select, and these are the keywords, and it will beneficial and it will help them to find out the another research articles regarding only on the specific topic, right? Now collect the background information. From where you collect the background information? But obviously you can collect the background information from the books as well as the literatures, right? And the new technique, right, resources, you can say that. And whatever the old ideas or the old methods or the old techniques in this field. And you will get knowledge through the journals and magazines, that is the periodicals, right? So you have to read the journals, you have to read the magazines. So you will definitely get some ideas that what are the things conducted by the people, or what are the other researchers done by the another people. And definitely encyclopedia is the best option. So it will give you a lot of data regarding your topic and regarding your interest. and I'll already discuss about the keywords, that we have keywords also. So from the help of the keywords, we can find out the another research papers or the another thing, right, or the data regarding this topic. And the last one is the web search engines. Like we are using the Google Scholars, PubMed, Web of Science. So you can take help of these web engine research searches, and you can find out the materials that is available on these sites also. Right? So whenever you collect all these things, now the background study, then your idea will become clear. Okay, that I am using this technique and I am taking this topic and I am only on focused on the specific part of this topic. Right? So it will already narrow down your topic, and you are not biased with the results and you are not biased with the other things. Right? Then when you choose and when you selecting all the things now, then the last thing comes to into mind, that think of who, what, when, where and why. Why you are doing this research? To whom you are doing this research? Is it important or not? Right? So these are the very crucial things. We have to focus on this. So why? Why we are choosing this? It is on interest, right? It is beneficial for the public. It is beneficial for the society. And what are the opinions about it, right? So first thing is why we are choosing this topic. So must clear in mind कि ये topic ही मैंने क्यों choose किया, right? Because it will also ask during the vivas, and it will also ask during when you are giving presentations regarding the topic now. Then definitely they will ask you, why are you choosing this topic? So you must clear कि why are you choosing? Then who is going to be benefited? Obviously, when you are doing research, then you must know कि किसको benefit है इससे? अपने आप के लिए कर रहे हैं क्या हम वो? No. So obviously the society is getting benefited, right? The fraternity of homeopathy, even the other societies like the modern medicine, if they are going to follow the research or if they are reading our research, so definitely they will have an impact that definitely the homeopathy is worked well. So then they will also follow our concept and they will always accept our pathies, right? Because this is a very challenging thing, as you all know, right?
Yes, ma'am.
Then
We are fighting, still fighting.
what is, yeah, definitely. And it's a very bad thing that we are facing every day in our lives with the modern medicine people, that what you are people doing, and these are the old concepts and you are still following all these things, right? But see, but definitely we are getting the results in the homeopathy cases.
Yes, ma'am.
But what is the need of this? If we are getting the results now, we should publish our results so that the people will know. Yeah, definitely. Because if we are not going to publish and we are collecting the data in our clinics also and put in our drawers also, then it's of no use, right?
Yes, ma'am.
So definitely we need to do publish, right? Okay. So back to the topic. Then what is the importance? Is it feasible? क्या फायदे में रहेगा ये टॉपिक? लोगों के काम आएगा? Benefited है या नहीं है? Right? So that's why we are using this. Then where it is going to be important? At the national level, at the international level, or the local level, where it is important, right? And when you collect all these things now, then we will be very, very clear that why I am choosing this thing, right? Then specific place affected the topic. कौन सा specific place है? Like if you are sitting in the Pune, right? And if you are sitting in a current locality, so definitely you will find out which things or which are the diseases occurs in that area. Like in the city where I am sitting now, here I am seeing that the patients are disturbed from the GIT and lot of skin infection patients, right? So my target is only on the skin infection and on the GIT. Only 1% cases I am seeing the respiratory disorder. See, so this is the areas. So we should focus. So I can do research. If I'm planning for doing the research now, so definitely I am choosing these two topics, right? Because I will collect the data, right? Then when it is important for the present, it is important for the future, or when it is important, or it is having a historical value. So we need to know the who, what, when, where, and why. So whenever you know all these things now, then definitely your topic will be clarified to you also, as well as to your mentors, guide, and to whom you are presenting, right?
Yes, ma'am.
Now, to come to the point, what are the challenges in the homeopathy and in the organon?
Yes, ma'am.
See, as you know that the organon is a philosophical subject and a theoretical subject, and the people are sleeping during the classes, right? I will do the same thing, right? And
I
even
remember
in
now
my
this, ma'am.
BHMS, yes. So we are doing the same things, right? So it's a very old material and it's proved years ago, right? So we need to find and we need to do more researches in this field, right? It's our basic importance, it's our basic need कि हमें इसके अंदर और researches करनी पड़ेंगी. Then it is totally based on theories and philosophy, and now the people are not believing on theories and the philosophy. What people are wanted, that they wanted the results, right? So how can we show the
Exactly.
results, right? So we can show our results by publish our papers, publish our cases, and show our results to the society, right? So definitely it will help us, right? Then see, Dr. Henneman gives us a beautiful sign, right? So see, 276 years back, he will give the sign, right? And the things he is mentioned in the organon now, it's still unknown to so many persons. Whenever you read the organon aphorism now, every time you will find some new things. Even nowadays, when I'm reading the organon and teach to my students now, then after one aphorism, I will get some new things. And whatever I taught in the previous lecture now, then I realized, no, something new should be added. So I will get some new ideas on the next lecture. So it will definitely increase our knowledge because we didn't have that type of mind that the Dr. Henneman was having, right? Because he was a very brilliant mind, right? So
Yes,
definitely we
ma'am.
need to collaborate with the other fields also, other sciences also, so that they will understand our science, right? And they will little bit teach us, and then we also explain about our theories or our philosophies, and then will become a fruitful results in front of the society, right? So we need to do the collaboration. Then I already told you that records, cases, and
Yes,
researches
ma'am.
must be published, right? Then see what are the challenges for the organ students now. So these are the challenges. Now what are the topics they are going to be decide in their research
Yes, ma'am.
topic? See, the first one is the people are choosing the susceptibility, right? That we are choosing the susceptibility, but we have an old concept like susceptibility higher, the susceptibility higher the potency, right? But what is the exact thing? We don't know,
Exactly.
right? And we cannot prove these things, right? But at least we can do one thing, like if we are taking children's only, then we can say, okay, we are only prescribing the high potency remedy to the children so that we can identify that the susceptibility mentioned by the philosophers or mentioned by the other stalwarts, is it right or wrong, right? Obviously it is right, but we are doing some input in these researches, right? Then we are selecting the middle age group, right? A middle age group ke andar is every new beginner homeopath, what they are doing, that they are prescribing remedies in 30 potency, right? Starting with the 30, then later on 200. 1M to think ही नहीं करना, and 10M it's beyond our limit, right?
Yes,
And
ma'am.
we never thought
We
of
only
the LM potency. See, this is the reality. So what we can do in these things, like you are choosing a middle age group. As mentioned that middle age group is only susceptible for the medium potency. It is mentioned already in the book. So you can do, okay, I am giving only medium potencies to these patients. Then see what are the results. Then you do that you are giving high potencies to these medium middle age people and see the results. Then the lower and then the higher, that is the LM potencies. Then definitely you will get the comparative results. Lower potencies, medium potencies, and the higher potencies. So definitely it will be a research, right? And what is the role of the vaccination and what is the susceptibility? So nowadays it is a very booming topic, right? Because we have seen in the TV ads and in the previous days in the Corona times, everybody is heading towards the vaccination or the first dose, second dose. Now the booster dose is coming, right? But still there are so many people, they are not taking the vaccination.
Yes, ma'am.
And
There are a lot
even they
of
are
people.
not suffered from the corona, right? Then definitely it's a role of the susceptibility, right? So
Very
we can do
definitely.
correlation between the vaccination and the susceptibility. And we have seen in our daily practices that those people who are taking the vaccinations, they are getting so many difficulties and so many side effects after these vaccinations, right? We are seeing in our daily cases, right? So we can do research on this topic also. Then what is the role of the disease manifestation? We can also take and apply susceptibility in disease manifestations also, right? Because everyone, because we are using the individualization concept, right? And everyone is not suffer from a single disease, right?
Yes, ma'am.
Every person is having the lifestyle disorder, right?
Exactly.
And people are
Heart
coming
disorder.
from a different, they are not coming from only the one symptom, they're coming from so many another symptoms, and each and every symptom different from different systems, right? So
Yes, ma'am.
definitely the disease impacted on the whole body, different systems if it is impacted. So what is the disease manifestation and the role of the susceptibility? So we can take this topic also. Then the second one is very interesting, that is case taking, as you all know,
Yes, ma'am.
right? But see, case taking itself is a very broad topic, and every
Yes, ma'am.
homeopathy is
It's very
having
big topic.
different ideas regarding the case taking. But what you can do, because we are focusing on the narrow field, right? We are focusing on a limited area so that we can prove to the society, right? So we can work on the body languages also, right?
Yes, ma'am.
Then we are giving importance to the past history and the family history. So we are only going to select only those two things, and we can find out what are the importance of these things in the case taking, right? And even nowadays, even the people are still asking, why are you asking so many questions in this disease? मुझे तो इतना कोई जरूरत ही नहीं है, मुझे तो सिर्फ इतनी सी तकलीफ
Yes,
है,
ma'am.
right? But they people do not understand that what is the importance of this. But we know that what is the importance, right? So if a patient is coming from diarrhea ना, continuous diarrhea for the last इतने टाइम से और बार बार हो जाता है, recurrent है ना, तो भी we are taking the past history, and the people are saying, why are we taking the past history and the family history? सिर्फ diarrhea ही तो है, right? So it is important for us. So we can take these two things. Then the diet and regimen. See, so many diseases are controlled by and even uh, cured by the diet and the regimen, right?
Yes, ma'am.
Because
Yes, ma'am.
you know that Dr. Henneman's time now, every person is having the sora, right? But nowadays what we are seeing, sora kahan hai? We don't know, right?
Yes.
Nobody is psoric. Everybody is showing their psychotic characteristic or the syphilitic characteristic, right? And definitely whenever we are meeting with our friends or society now, then automatically the psychotic characters come up,
Yes, ma'am.
right?
This is very true, ma'am.
So, and we are discussing about the, find out the sora and find out the syphilitic, then you will get the remedy. See, it's very difficult because nowadays the habits of the food are totally changes. The lifestyle is totally changes. People are heading towards the luxury lifestyles, right? So the disease are developing like this ways on also, right? So we need to modify ourselves. We not stick to the previous concept कि नहीं मेरे को तो वो सौरा ही find out करना है. Definitely you will find out. You must find out. But it will take a lot of time, right? And a lot of patience. So at least whatever the things you are doing easily now, so focus on that thing. Because you have to stay with the patience, right? So you can control the things with the diet and the regimen. So you can take this diet and regimen in acute cases as well as in the chronic cases. Then the most interesting topic is the miasm, right? What is the therapeutic implications of the miasm? Then, for example, patients, you are choosing the patients of the paralysis, right? So you are only choosing one miasm. That what are the syphilitic characteristics in the paralysis, right? What are the syphilitic, what are the psoric characters in the paralysis? No need to find out the sora, no need to find out the psychotic, or no need to find out the syphilitic, because you are doing the research, right? So you are focused on only one miasm. No, I am only taking the psychotic miasm. No, I am only taking the syphilitic miasm. No, I am working on the psoric miasm, right? So you can compare. So first you compare with this psoric, then psychotic, and then syphilitic, and then you compare the results with the three. Then definitely you will find out something beneficial, right? Then the thing is, which disease we are choosing. This is the biggest questions in the Organon of Medicine subject.
Yes, ma'am.
See, you can choose any disease because homeopathy works on each and every disease. It is not only focused on the cough, coryza, fever, acute diseases. No, you can choose any of the diseases, right? So it's not a big question कि कौन सी disease choose करें, right? Then there are different approaches. People are using the individualized approach. Yes, you can take the individualized approach. You can choose the constitutional approach, right? You can only focus on the portrait of the disease. You can only focus on the totality of the symptoms. You can only focus on the mental symptoms, right? And you can only focus on the temperament. So it's up to you, whatever the things you are choosing. See, if you are choosing the individual, so definitely you will collect the whole things. You will collect the whole data, right? So if you minimize your topics or minimize your research areas now, then you will select only one thing. And even you can do the comparative studies also. Like previously I am giving you the example that I am taking syphilitic miasm in the paralytic condition. So you can do a comparative research. In few cases I am taking the psychotic and in few cases I am taking the syphilitic. And it's a comparison between the two things, right? Then you can also choose the second prescription. And you will find lot of researches on these topics. It is also available, right? So read the previous researches and then find out that what you are going to be add in this. Because it is already done by some people. But आप इसमें नया क्या करो, that is important, right?
Exactly.
Then posology, it's a very challenging, it's a very confusing and broad topic, you can say that. So it's up to your knowledge, right? And we can also say that ki susceptibility ka role hai. Definitely, these things are come together when we are talking about the pathology, right? So what is the acute prescribing in the therapeutic implication? Acute prescribing में क्या दे सकते हैं? Pathology का role क्या है? Then what is the role of the modalities, right? So we can identify these things. And you can take a specific remedy, like I'm only prescribing the 30 potency, I'm only prescribing the 200, I'm only working on the LM potency, right? And definitely you will find the result, right? Then you can also take the obstacles in the homeopathy practice. It's also a research. Meet the homeopathic fraternity and ask them what are the challenges you are facing in the homeopathy practices. You know, you will get a bulk of queries, you will get a bulk of obstacles, you will get a bulk of data regarding these, right? And it's very difficult to settle your practice for the new beginners, right? And you can do research on, yeah, definitely. So it's a very new challenge, right? And you can do research on that Kent 12 observation, right? So there are 12 observations. You can only focus on one and prove that one, right? So one by one you are taking all the Kent 12 observation and you can prove. Then see, while going to the previous data, so I have found that various researches are done on the laws of homeopathy, like law of similia, law of simplex. Even we read all these things in the MD part also, right? So you can find out on the net and the data is easily available. So you can take only the law of similia. I am proving the law of similia. So what is the similia? That is the similar, right? And definitely being a homeopath, we are going to the similar remedy, right? We are not talking about that कि मैं इसको same remedy दे देता हूँ, चलो ये नहीं है इसके बदले में ये दे देता हूँ. No. So when we are talking about the similar, so why don't you do research on this topic? So collect the cases, only one condition and give the similar remedies, and then you prove कि इसके अंदर similar का मैंने क्या result देखा, right? इसी तरह से you take the law of minimum. See, we are giving very small remedies to the patient. and see the allopaths, they are giving you the, but people are taking 25 medicines together on their hand and they will taking it
Yes, ma'am.
together, right? So the bulk of the remedies are the people are taking, right? So what we can do, that we are giving only the minimum remedies, only one dose or the single dose or two dose, चलो ठीक है, कभी कभी थ्री डोज भी हो जाती होंगी, इससे ज्यादा तो नहीं। तो जब आप वो इतनी फ्यू डोजेस दे रहे हो, देन व्हाट इज द इम्पोर्टेंस, सो प्रूव दैट थिंग दैट सी वी आर गिविंग ओनली सिंगल डोज टू द पेशेंट एंड previously the patient having these things and now the patients are having these things, right? You must have record the data, the previous reports as well as the after reports, right? Because it will show the thing. But if we are only verbally saying all these things, na mere patient ko aaram mil gaya, nobody will believe. Everybody is believe on the report, right? Whatever the indications or whatever the things that are mentioned in the reports, everyone is believing in this thing, right? So always collect the data. Then herring law of cure, right? So one tool is using nowadays, even so many PhD scholars are doing research on this topic, that is the HILAT, herring law of assessment tool. So you can use this tool in your researches also, in your chronic cases as well as the acute cases. It is basically this tool is only for the acute cases, but we have seen that so many PhD scholars are using this tool in the chronic cases. So you can take this tool. So this is all about the things that we are going to discuss in this session, that what are the topics you are choosing and what are the things you have to choose, and different points we have discussed, right? So you must focus on your topic, then think कि आपको क्या करना क्या है, right? And then find out the informative things, right? And whenever you are doing the research, now be confident, right? And discuss with the people because they will give you some ideas, right? And there are so many topics, you can find it on the net also. That susceptibility पे बहुत सारा research हुआ है, pathology, second prescription. So these are the booming topics, and even the miasm, right? So you can read out these topics and find out कि आपको इसमें से क्या करना है, what is important for you and what you are going to take interest in, right? So this will be beneficial for you, and hope you are doing the researches in the homeopathy more and more, and definitely you will publish it on the peer-reviewed journals or some good journals, so that the people will have the data regarding the homeopathy also. Right? It is not for me only, it is for all the homeopaths and for all the homeopathic fraternity. Right?
yes, ma'am.
So this is all about the session.
Yes, ma'am. And thank you so much, actually.